U.S. 6th District Congressman Ben Cline may not have been there last week when a group rallied outside his office for lower prescription drug prices, but he's not ignoring the issue.
I agree that the American people are frustrated about the high cost of health care, especially prescription drugs. They're calling on us to work together to solve these problems. And since I was elected last November, I've held over a dozen town hall meetings in my district where the rising cost of health care and prescription drugs is at the forefront of my constituents' concerns.
During a congressional session this week, Cline denounced the HR3 bill as the answer.
However, I believe this legislation is the wrong approach. It was crafted behind closed doors and without valuable input or a collaborative committee process. Its drafting is the epitome of what the average American despises about Congress. It's also the wrong approach for several reasons that I thought would have become clear after the majority went down this road with Obamacare.
Cline cites too much government interference as one of the problems with the HR3 bill.
The HR3 requirement that the HHS secretary to make HHS negotiated prices available to the commercial market requires an unprecedented government interference in the private market. However, price setting is not negotiation. The bill requires the government to dictate prices by threatening a 95% tax on companies that fail to comply. Countries that have adopted drug pricing systems similar to what is included in HR3 face decreased access to new drugs, increased wait times for patients, and supply shortages. Finally, research and development of new treatments and cures will see significant reductions because of the higher tax. Make no mistake, government price setting leads to patient access restriction.
Bill Ritchie is in favor of the HR3 bill. Ritchie was among the protesters. He says the current legislation is not working for the people purchasing medication.
The rich are getting wealthier and the poor are getting poorer, and it's really affecting issues like the pharmaceutical companies get paid to do their research, and then they make giant profits, and they have large investors, even HMOs and a lot of hospitals.
In Virginia, HR3 has the potential to decimate an industry that is an important employer and contributor to Virginia's economy. The biopharmaceutical industry supports nearly 41,000 jobs in Virginia and $10 billion in economic output annually. The biopharmaceutical sector's Virginia manufacturing footprint includes 8 plants involved in the production of human-used medicines, including one in my district that recently announced a significant expansion. HR3 threatens the hundreds of jobs in my district related to this industry.
Another member of Virginia Organizing says there's a reason they chose Cline's Harrisonburg office.
He sits on a committee that is going to be hearing this bill, and so we would really like to have confirmation of his support of this issue and his constituents, and hopefully we'll be making more noise about this in the future.
There's no doubt that Congress must act to lower prescription drug prices to ensure people can afford the medications they need. But let's not go down the same road with prescription drugs that we went down with health insurance. That's why I'm the lead co-sponsor of the Terminating the Extension of Rights Misappropriated Act, or TERM Act, bipartisan legislation that would allow for the quicker introduction of generic medications to the marketplace by ending the practice of evergreening by pharmaceutical companies. I do not intend to support HR3 as it stands before us currently, and I hope that we can find a better solution to lowering drug prices.
Eaine Rackley for Breaking Through News.